I'm Glen. I'm a professor of health services research in the College of Public Health at University of Kentucky, and I've been here a little over 5 years now. The Systems for Action program is a relatively new research program created by the Robert Wood Johnson Foundation, and it's actually headquartered right here at University of Kentucky. And our goal with that program is to produce new scientific evidence about how to align delivery systems for medical care, but also for public health and social services in ways that improve health for the population overall. Health Affairs is definitely one of the leading health policy and health research journals in the U.S., and in particular, it has a niche in really helping to take research and put it in the hands of policymakers in ways that they can make use of it for improving health policy. Our study, we were really trying to answer one of these fundamental questions surrounding the Affordable Care Act here in the U.S., which is how can we improve health status for the population at large, not one patient at a time, but looking at strategies for improving population-wide health status. The Affordable Care Act had a number of goals, and one of which was to improve health insurance coverage, a second of which was to try to constrain the rate of growth in healthcare costs, but the third was actually improving health status at the population level, what we call population health improvement. And so it was really that third aim of the Affordable Care Act that we were looking at, whether the extent to which the nation as a whole was making progress in improving population health, and how those population health strategies were actually impacting a fundamental measure of health, which is mortality from preventable conditions. If your goal is to improve health status for the population at large, a lot of the strategies that we have to use have to do with not just treating illnesses and injuries once they occur, but tackling fundamental drivers of health and well-being and try to prevent a lot of those factors before they occur. That means we need to look at changes in strategies over time and look at the evolution of health status in a population over time. So our study took a 16-year window of time to look at these kind of dynamics. We looked at a broad array of health conditions and looked at deaths from potentially preventable conditions, cardiovascular disease, diabetes, cancer, influenza in particular. So we looked at those fundamental markers of population health. And then we also looked at, in terms of the strategies being used, we looked at an array of widely recommended population health improvement strategies that the federal government and other experts have been recommending for a long time that we use more broadly in communities to improve health status. We studied about 360 communities that we selected way back at the beginning of the study, back in 1998. These were communities that were selected to be nationally representative of metropolitan areas across the U.S. Over time, communities that were able to implement a broad spectrum of population health activities, and they were able to implement those activities by engaging a broad array of stakeholders in the community, healthcare delivery stakeholders, health insurers, employers, and others. Those communities, which we call comprehensive population health systems, saw large reductions in their rates of preventable mortality. Reductions in heart disease and diabetes, some of the major preventable causes of death in the U.S., we saw reductions of more than 20% in communities that were able to implement that broad spectrum of activities. We were able to show for really the first time on a nationwide basis what the aggregate health impact of those activities could be, and they were really sizable, on the order of as large or perhaps larger than any health impacts we've been able to measure for other kind of strategies like improving health insurance coverage. We also found that only about a third of U.S. communities achieved that level of supporting a broad spectrum of population health activities. So that means that 2/3 of our communities are still not able to benefit from these kinds of activities. So a lot of our work going forward is going to focus on how we can move more communities into supporting this broad spectrum of population health activities, building these dense collaborative networks to support these activities. I think one other important element of our study has to do with another major challenge of health reform, and that's how we can reduce disparities in health status across our country, racial and ethnic disparities based on socioeconomic status. And that's another intriguing aspect of our research, shows that these population health activities have some of their largest effects in reducing mortality in low-income communities. And so that signals to us that potentially these population health strategies can not only help us improve aggregate health status, but they can help us reduce disparities in health status, another very important moral as well as policy imperative for the U.S.